Okay, hello from ERA EDTI virtual meeting. I am Dr. Edoardo Melilli. I am a nephrologist working in Barcelona, and I'm very happy because today I will present you Cindy George. She is an epidemiologist from South Africa, and she is one of the winner of the poster selected, social media selected award. Cindy will present her work about to create a consortium in Africa, in a huge continent, a consortium focused on CKD. So Cindy, please share your result, and congrats again for winner this award.
Thank you very much for giving me the opportunity to be able to present the work that we are currently doing. Let me just share my screen with you. There we go. Okay, so today I just briefly want to tell you about the CKD-AFRICA Collaboration, which is an African network for chronic kidney disease epidemiology. So just a bit of background. So chronic kidney disease is a global health problem. However, it disproportionately affects African countries. We do have a lack of data in Africa, and we do also have some limitations towards the data that we do have. So in essence, the true magnitude of CKD is still quite unknown on the continent. So I must admit that there has been an increase in reports on CKD prevalence over the recent years. However, to date, there's not really been a coordinated effort that would be able to provide reliable estimates to support health services on the continent. So that's basically where the CKD-AFRICA Consortium started. So it's an initiative of the South African Medical Research Council, and it was established to address this gap in knowledge that we currently have with regards to the epidemiology and prevention of CKD. So how we do this is we collate data at individual participant level from existing studies in Africa. So our aim is to utilize the available data from prevalence studies on CKD that would then provide a more updated and comprehensive synthesis of the burden of CKD in Africa. We also want to bring together active researchers in the field of CKD epidemiology and sort of provide this platform where we can sit and plan future observation and intervention studies related to CKD. So what we did was, when we established this consortium, we sent out a call to potential collaborators, and we actually received quite a good response from our African collaborators. So to date, we currently have roughly about 27,000 data points on individuals. So from the 134 studies that we initially invited, 42 of them agreed to participate. And this data is from the general population, but it is also from the high-risk subpopulation. So your HIV, your population with hypertension, as well as diabetes. So when we break it down and we look at the distribution of the data that we currently have access to, we currently stand at roughly about 11 countries within Africa. There's still a lot of, as you can see, a lot of grayed out areas. So these are the countries that we don't currently have a footing in. But obviously it's a continuous process. So we continuously send out calls for collaborators and ask them to, if they would be interested in participating in this platform. When we break it down into the number of studies that we currently have, as you can see, the general population, we generally have the most studies from that subgroup. But when we break it down into the absolute numbers, you can see the HIV population, we have roughly about 12,000 participants in that subgroup. So in essence, to conclude, we believe that the research that we'll be able to obtain from this collaboration will permit the exploration in understanding the diversity of the clinical manifestations of kidney disease on the continent. Thank you very much.
Okay, thank you, Cindy. It's very nice work. I think that it was a very hard work to find all these investigators in such
For sure.
huge continent like Africa. I
Yes.
just want make a question for you. What do you think? What is the first after that you created this consortium? What is the main the first study that you will analyze generally? If you have a main focus or
Yeah, sure. So we are actually currently busy with our first set of analysis. So we would like to investigate what is the true prevalence, what's the true burden of CKD in the general population. So we're starting off with the data that we have from the general population, and we would like to investigate where we currently stand at.
Okay, I think that this is the first step that you have to do. No?
For sure. Yes.
Okay, we just finished. Thank you very much again to participate, and that's all. Thank you.
Thanks again for giving me this opportunity.
Bye.
Bye-bye.